Hey, hey, welcome to Next Nation, the podcast. I am your host, Sylvia Alston. Over the last year, I know that I am not alone when I say that our lives have been turned upside down by the pandemic and the presence of COVID 19. It has affected every center of our country, every profit center, every educational system, every hospital and administration system, every layer of our government, every layer of our private industry has been affected by COVID 19. And there's a lot of opportunity to make amendments and change on how we have conversation about equity, about standards of care, and about how this country endeavors and seeks to make sure that the care and the health in this country is doled out equitably. As of the taping of this episode, we've seen over 440,000 people die from COVID. And unfortunately, that number continues to increase. This past week, I read in Politico that of the 26 million people who've been vaccinated thus far, only 5% of that number are African American. And in the Latino community, that number is even. Although African Americans are 8 times more likely to die from COVID than their white counterparts, and Latinos are 11 times more likely to die than their white counterparts. Something is happening in this country, and it's wrong. It's wrong. We have to address our standard and our measure of care in under-resourced and in underserved communities. And so I invited in guests today to have that discussion. Dr. Ebony Jade Hilton Buckles, who is at UVA Health. She's a critical care physician as well as an anesthesiologist. And she also is the co-founder of a private practice. She attended the College of Charleston. She hails from South Carolina, a small town by the name of Little Africa, South Carolina. And she began her studies at the Medical University of South Carolina. And like I said, she's on staff at UVA in their anesthesiology and critical care. Her clients and her patients are her primary focus. And so we invited her in to kind of talk through some of the statistics, some of the data points, and some of the issues inside the discussion around the pandemic and around the vaccine process. Also invited friend to the show. So before we started the podcast and while we were on SiriusXM, he was a frequent contributor and guest to the platform, Dr. Rashad Holmes. He is a professor at the Mecca, Howard University. And he is also a human resources administrator for the government. He works in their health and human services division. And he also has a breadth of experience in conversations around equity and around how care is applied by class and by socioeconomic status. And so on today's episode, I am talking to Dr. Rashad Holmes and also Dr. Ebony Jade Hilton, and we'll be discussing in full our thoughts about the economic injustice, the medical injustice, and the standard of care that needs to happen and the access to care that needs to happen in Black and Brown communities in order to normalize and to effectively take hold for the vaccination for COVID-19? So, for the first time ever, welcome to Next Nation, the podcast. Dr. Ebony Hilton, MD, critical care doctor, as well as anesthesiologist at UVA Health. And then Dr. Rashad Holmes, good friend of Next Nation from SiriusXM Urban View, and now your first time as a guest on Next Nation, the podcast. So, welcome back or welcome for the first time, however we want to call it. But thank you so much for both of you being here.
Yeah, thank you
Thank
for having
you
me.
for the invitation.
Yeah.
So, listen, I want to kick it off by first saying that we are actively in the month, the shortest month of the year, which we know as Black History Month. Uh, I want to start by talking about living Black history because I think you both are a piece of what makes our history so rich and wonderful. So I want to give you both an opportunity to just kind of start with how you got your start. So, Dr. Hilton, since it's your first time, we'll start with you, ladies first.
Right, right. Yeah, kind of started early on. I was born in the middle of three girls, single parent home. And when I was 8 years old, my little sister asked if we could have a brother. My mom told us at that time our parents' first child was actually a little boy that when my parents got their first child when she was 17 years old, went to a free clinic. And unfortunately, during one of the tests, whatever they were doing, she said she felt a sharp pain, and from that day forward started to leak fluid. And so she called back and told them, "Hey, I'm leaking fluid. Is this normal? I'm 17. It's my first baby." And they told her, "Yeah, everything is fine." Needless to say, within days she went into labor. He lived for 3 days and he passed away. And so my mom telling me that when I was 8, that was the first time I ever really remember her crying. And I made in my mind at that time that I want to be a doctor so I can prevent that from happening. Did not know exactly what that meant. But yeah, and so now my entire career is really focused on looking at racial health disparities and how can we uncover the root cause of that to eradicate it for generations to come.
So that inspired your entire career. Wow.
Mm-hmm. Mm-hmm.
Wow.
Yeah.
That's wonderful. Where were you educated?
Well, actually, I did my training all in Charleston, South Carolina. So, College of Charleston for undergrad, and then med school residency fellowship was at the Medical University of South Carolina. Graduated there in 2013 during my fellowship, and stayed there working for approximately 6 years before coming to the University of Virginia. So,
Yeah, and so you're originally from South Carolina, right?
yeah.
And so to me, that gives a little bit that helps to frame,
Mhm.
why you went into health and address racial disparities because we know how South Carolina is
Mhm.
comprised.
Right.
It's a state that is heavily populated with Black populace. One of the first places that Blacks arrived in
Right.
this country.
Right.
Um, and we also know that the educational system in South Carolina, as well as the health system, has been compromised
Mhm.
since its beginnings.
Right.
So, did that inform some of the reason why you also wanted to address racial health disparities?
Oh, completely. And what I recognize in growing up in medicine is that racial health disparities, unfortunately, isn't just tied to the deep racist South, because that's what we
For
oftentimes are
sure.
taught. But if we look at it right now in the United States with COVID-19, for instance, for every 22 states that we have, or 22 of our states, one out of every 1,000 Black people that were residents of that state has now died of COVID-19. We're seeing racial health disparities in not only the infection rate, but also the hospitalization and the death rate, unfortunately, with COVID. So racism and the systemic racism is just that it literally is systemic. It's not regional. It's not isolated to East Coast versus West Coast. We're seeing it as far up as Maine, that had the worst racial health disparities there for a while, which population is only 1.6% African American, but yet by I think it was around August or so, 25% of their cases were actually African American.
For African
Now
American. Yeah.
it's 7%, so it's still 5 times their population density. So, like I said, it's not just in the deep South. We have to address this issue of difference in haves and have-nots in America. From the federal level to address
Mhm.
all states.
Yeah. Dr. Ray, I want to bring you into the conversation here because I know this speaks to your spirit quite a bit.
Ay,
Um,
ay, ay.
Yeah, tell us a little bit about your background. You are a professor at Howard University, known as
Yes.
the Mecca.
Yes.
You got your education at Georgetown,
Yes.
but you center your work around working with Black MBAs, and tell me why you think that's important.
Oh, so much to say, Sylvia. My dissertation is where some of this kind of started, and I got this clarity, and it focused on emotional intelligence and the distinctions that can be made within socioeconomic status groups.
Mhm.
So it's going to tie in to what we're experiencing with the racial disparity. Uh, I realized how uncomfortable it is to talk about class, and then kind of wrote my mission statement for myself to open up doors for people to do what I've done better. But that means we've got to give them the tools.
Mhm.
So teaching at Howard provides an opportunity to do just that. Every semester I get a cadre of people that will go on to be leaders and managers and shape both family and professional life for a number of different communities. And so my interest is A, pouring into them. Professionally, I also do work in human resources. You know, it's a few different things, but this is clearly a passion. And as I tell them often, work that I would do for free, just don't tell Howard.
Right.
Yeah, I love it. You invite me in to talk to your students every semester, and I really
Mhm,
appreciate that time. And one of the things that becomes, pretty clear, and you talk about class, is you have all walks of life in
mhm.
your classroom. And unfortunately, when we think about the disparities and how this disease even affects populations, we have to bring the conversation of class into the discussion,
Yes, we do.
and it's uncomfortable, right?
Mhm,
But I think that too often the way in which different classes of people access care has everything to do with, now as we talk about vaccination and vaccination for the disease for COVID
mhm.
and how it's being accessed, how it's being distributed. We have to talk about what some of the disparities and some of the issues are for people getting access to the vaccination, and then also the exposure, the hospitalization rate, and then the effects of death and throughout about the disease. So we have to talk about it. So let's do it.
Okay.
Um, you both raise so many, I think, pivotal thoughts about why this work is important for you. I want to talk about some of the reading that I found this past week in Politico. Says that Johnson & Johnson has a new vaccination that they are testing. They've tested it 66%. It has 66% effective rate globally. 72% it's been effective in the USA. We are now talking about 3 different variants of this disease,
Mhm.
while we discuss the vaccination, and we also know that as of right now, over 26 million people have already been vaccinated, and out of that 26 million, only 5% of those people represent African Americans. Let's
Mhm.
talk about that.
Right. I
Dr.
mean,
Hilton.
yeah, it's one of those things. I'm not surprised
Mhm,
when we're looking at rates of vaccination. The discussion was heavily pushed that this is a distrust issue, of which, yes, we can talk about medical distrust, but medical distrust isn't just isolated to Black people, so that's not accounting for why we're being vaccinated at lower rates. We have the anti-vaxxers and the now COVID hoaxers and anti-maskers that are also anti-vax or are anti-COVID vaccine.
Mhm.
But yet we're not seeing the numbers pushed in their direction. But for us, I think the real reason or the real thing that we need to tackle is that equity was never planned for this COVID vaccine rollout. When we're looking at even how we are categorizing who fits into phase 1A and phase 1B, Black and Brown people are largely left out of the discussion. Phase 1A is healthcare workers, and of which and when we're talking healthcare workers, we're not just talking about doctors and nurses. They extended it to even include nurses, aides, and persons that are in the nursing homes, which is heavily weighted with African Americans. But
And
yet,
sure, and all hospital personnel.
Right.
are largely African American.
Right. But yet, healthcare workers totality, 60% are white, 16% are African Americans. When we're looking at nursing home residents, which are also phase 1A, we know it takes money to put your family into a nursing home. 78% of nursing home residents are white. When we're looking even at phase 1B, now we're going down, they say 65 and older, or if you have pre-existing conditions. But if we look at the US population that is 65 and older, it's 77% white. So what we're basically saying is Black people, you have to have one of your organs failed on you. Either your kidneys are no longer working, you have diabetes, your heart failure, you have chronic lung disease. Some part of your body must now not be functioning in order for you to be considered. Whereas white people in that phase 1B, you simply just have to live a graceful life to get to the age of 65. Because unfortunately, there's been a paucity of life for Black people since literally 1619, when the first of us were brought to the shores of Virginia. Our life expectancy is only 75 nationally. So these are the things when we're looking at why we see this stark difference in numbers. We should not be surprised, because Black people on large were not considered to be the first persons to be vaccinated, despite the fact that we are 3 times more likely to die from COVID-19.
Mm-hmm.
Right.
I think the other part of it is that in the distribution plan, Sylvia, the needs of communities of color and Black people hasn't been a part of the conversation. So I echo some of what Dr. Hilton is talking about, but at a practical level, you're telling, let's go to prioritization group 1B, you're telling a 65-year-old or 68-year-old to either call into a number, basically like a radio station,
Right.
or get on the internet and find the place where I can make an appointment. And this stuff was these appointments were harder to get than Beyonce tickets in some locales. It was never set up to be effective for those communities.
Yeah.
No one has come.
Well, when you think about how we even approach doctor's visits, I know we are in the middle of a great medical technological boom, but even asking 75 plus year old people to only be able to access their medical records or the appointments via a portal was
electronically.
It was never set up or
There was never
designed
intention to be
to work.
effective.
Yeah,
Nope.
I'm sorry to go back to your point.
No, I was just going to say it's areas or pockets of systemic racism all throughout the system, unfortunately. Even with scarcity, people that have access to resources and access get in line first. So, another part of this discussion will be how the wealthy have gotten access to this vaccine. And they're neither of the first 2 prioritization groups. Right. It's one of those where, yet again, wrong class, wrong skin color, you end up at the wrong place in the line. Despite the point that Dr. Hilton has made twice, we're suffering. Our community is suffering more than other communities.
Yeah. Yeah. I don't want to focus in on the previous administration and all of the mistakes of that last administration that led to, the hospitalization rate, increased hospitalization rates, the effects in which people are dying, the misinformation that was happening state to state, and the fact that federally we never seem to get on the same page, with a national response or a national presence. Everybody was doing something different. And I believe that exacerbated and led to the additional loss of life. We've got a new administration in. President Joe Biden, in his first few days of office, signed an executive order to make sure that racial health disparity and equity was a part of the conversation. Dr. Hilton, you've been petitioning for or calling for the establishment of a Secretary of Equity. Tell me why you think that's important.
Yes. Well, for one, because we know that health disparity, or not the health disparity, just racial disparities exist in literally every sector of society. We have disparities along the lines of education and the rates at which our children are being suspended or expelled, right? Are not progressing as far as their reading scores and their math scores by the 3rd grade, and yet we're making prison cells based on that. We have disparities in housing and whether or not we're owning houses versus renting houses versus getting evicted, like we're seeing in the masses this last month. We have disparities along the lines of wealth. We know that there's a wealth gap in this country, that for every dollar that Caucasians have, there's only 10 cents for African Americans. And it's not only wealth, it's also income. We know that last April, for instance, when people started getting fired, less than 50% of Black adults actually had a job. We know that there's differences and disparities along the lines of law matters, right? Legal matters. That's where the protests of George Floyd kind of sparked this whole transition where we had this intersection of pandemic and protest, because the same things that leads him to be at a higher risk of dying from police brutality are the same things that lead Black people from being at a higher risk of dying from COVID-19. It's the same thing. All those social determinants of health and all those these policies that are being formed that negatively impact Black and brown communities, but they're passed constantly on the federal level with our tax dollars enforcing those. And so my thought was, we need to establish in the presidential cabinet a Secretary of Equity, a department whose focus is truly looking at every single policy that comes out of those other departments needs to be looked at with the equity lens, not only for along racial lines, but also gender, also sexual orientation, any marginalized group that we see have worse outcomes across the board from, like I said, health to wealth. We need to know why and stop reporting the same exact disparities year after year after year, right? The same thing that killed, George Floyd was the same thing that killed Martin Luther King. Let's make some changes around here. And if we start to have some accountability to those metrics, then hopefully the next generation won't have to keep on saying that Black women are 3 times more likely to die during pregnancy. They were doing that back in slave times too. Let's change.
And of heart disease, and of
breast cancer, and of asthma. I mean, you can go on, but the problem is just like, again, what we're seeing with this COVID vaccine rollout, of where we studied Black and brown people and the fact that we're dying at higher rates for the last year. But when it came down to making policies and for the intervention that could save our lives, we were left off of the table. As being raised up as saying, these are the persons that are dying at higher rates. They should be the ones that are getting vaccinated first. We were left out of discussion because equity is an afterthought. If we had a Department of Equity, if we had a Secretary of Equity, from the very time that these policies are being formed, that will be the focus. Right. And that's the way I feel like we can change things. And until we have that, every administration will see where we shift one way and shift right back the next way, just like we did with Obama. And then here comes Trump. And now here comes Biden. It's a pendulum. And with that ever-changing dynamic process, we don't lead to true, concrete, workable things that, like I said, the next generation will have a chance to have solid footing on. So.
Yeah, well, when we speak about it from a legislative perspective, if unfortunately we've got such a divide right now in our political landscape that when we think about, just legislation, if people are not able to get policies through the system, through legislative action, I don't know that executive orders are sustainable, for long. So they're not sustainable for long swaths of time.
For sure, but if I'm starving, I'll take a Vienna sausage. I'm country, okay? At this point, Black people, we are starving. If you got to give it an executive order to establish this, and it gets erased, make that other person come to the foot of the American public and say that equity is not valuable to me. Make them say that. But until we actually hold our government accountable for saying that we are citizens too, and that if these policies are showing they have literally a direct impact on whether or not our children live or die, we're no longer allowing it to be even a matter of discussion. We pledge allegiance saying justice for all. Well, where is the health justice? Where is the educational justice? Where is the legal justice? It isn't for all yet. And that's what we have to do. We have to be bold in our declarations that this is a priority. For everyone to just be treated the same.
Dr. Holmes, I know you have something big to say about in response to that. We are up against our first break. I'm going to take a quick break and I'm going to come right back to you to give you an opportunity to respond. I'm your host, Sylvia Austin. This is Next Nation, and we'll be right back.
I'm Noah.
And I'm Ava.
And you're listening to our mom,
Sylvia K. Austin, on Next Nation, the podcast. Yes, sir.
We are back. Dr. Holmes, your response to Dr. Hilton's calls for a Secretary of Equity, why it's important, and how the disparities, need to be decided from a governmental standpoint. We need to address this. Give me your thoughts on what Dr. Hilton said. I thought it was
I think
brilliant.
it's overdue. I agree 300%. And I love the notion of equating justice or the injustice with different sectors. So there is a housing injustice. I agree with that. And I think every policy at the local, state, and federal level has adverse impact. So part of that equity responsibility is considering it in the design of the policy. How will, if someone had asked the question, how do we get the vaccine to a Black community? What are the concerns of that community?
Right.
Then perhaps you can design the rollout a lot better.
Right.
You can ask that community. Our community has doctors. Our community has nurses. Our community has people that have worked in healthcare settings. And so I think, Sylvia, it's overdue. I think it's necessary. I also think that it's a part of a very complicated puzzle. The other part that's missing after we have a conversation about equity, you kind of realize access is missing.
Right. And that's where
And,
I was going next.
and
Yeah.
it's huge. It's hard to be something you've never seen. It's hard to participate in a process that
Right.
you're not encouraged to participate in. And I think Stacey Abrams and so many others have brought full center for us, like full stop, the level of voter suppression that happened leading up to this past presidential election. And right now, a number of state legislatures, Georgia being surprisingly at the top of the list, are enacting more rules, getting rid of no excuse absentee ballot registration
Right.
or immediate registration, all of these things, yet again, to cut off our access to weigh into a policy or to empower and vote for someone that might stand up as Secretary of Equity. So it is systemic, and it is frustrating that we're still here. And we've gone so far, have come so far, and yet we have so much further to go.
Well, for me, I worry about how we keep the people engaged, right? Because if you look at social media, if you look at the news, if you look at the restaurants, the bars, the clubs, if you look at the fact that our entertainers have now started performing again, and people are showing up, depending on what locations you're talking about. I mean, I saw a video last week of City Girls performing in Miami, Florida, and it was packed. I mean, it was packed. There were people everywhere without masks. And now when I think about how people, when you talk about access, when I think about how people get information around, staying healthy, staying away from these types of things, we're not the way we access this information. If I think about it and just, doing the statistics and the data, Pew Research, okay, Nielsen ratings say that we don't access our news and our information by watching CNN and MSNBC every night. That's not where Black eyeballs are, okay? They traditionally get their information from social media. They traditionally get their information from the radio. But when I think about who's on the radio, who's passing out the information, what are they talking about? They're not having conversations in the by and large that look like this, right? So how are people accessing the information? How do we change that dynamic, especially in a year like 2021 when information is constantly at our fingertips? What do we do? I mean, I think about even some of our purported Black television stations don't even have a Black news show. It's just it's almost infuriating to me. If you look at every dynamic, we are under-resourced, okay?
Yeah.
We are underinformed. We
Yeah.
don't have access to the proper information. And I don't know how we change that. Discussions like this are important. But when I even think about the eyeballs that are in the that are paying attention to the podcasting space, it's about access, it's about reach, it's about communication, it's about network. And it just seems like we're falling short in so many different ways.
Yeah, and it's costing our lives. What people have to realize, when I saw that City Girls concert and when I saw Bow Wow's concert, it broke my heart, because what we know is right now, 41% of all new infections are ages 35 to 49 years old.
Mm.
That's not terribly old, right? When we're
Mhm.
No,
thinking about,
that's us, right?
I feel like it's not old. No, but in that same age group, if you are the ages of 35 to 44 years old and you are Black, you are 8 times more likely to die if you get infected with COVID than if you're white. If you are Hispanic and you are 35 to 44 years old, you are 11 times more likely to die if you get infected if you are than a white person. That's what we need to, the message. We are not speaking these numbers to the target audience. We keep using these words of, oh, it's old people or people with pre-existing condition. No, it's not. There are people who are just as young as us who don't have conditions at all that have been diagnosed, right? And they are dying, and we are leaving. You know, in New York City, there was a article that came out. I want to say it was in early fall, but for every 600 Black children in New York City, one had lost a parent. We are leaving people orphaned around this mess to go to a concert to see City Girls and Bow Wow. So if that means that we need to have these sit down conversations with those entertainers to talk to them so they can talk to their fans, then by all means, we need to do that. But what they did in that moment was not only jeopardize the lives of every person in that audience, when they go back to their parents, they have the ability to wipe out entire family units. And that's what we are seeing.
Yeah. And that's what we haven't talked yet about how the disease is presenting, because there are so many people where the disease is presenting and they are asymptomatic. Okay. But we know that they can take it home to an ill family member or someone with a pre-existing condition, and the disease presents in an entirely different way, right? I am struggling. I'm struggling. I am emotionally exhausted, Um, I often talk about a return, to life before COVID, and I don't think it exists. I honestly don't think it exists. There's so many new protocols and so many, new design. There's so many different things that we need to do and change. And I just don't think even or almost approaching a year of this disease in our culture, that we're there yet. We're not there yet.
I think,
Yeah.
Sylvia, I was going to say, maybe this is an add-on to the equity panel, but I want to address a little bit about our community and how unique we are. And by unique, I mean we've got different pockets, different age groups doing a whole lot of different things.
Right.
We need people that speak to those audiences
Mhm.
because the three of us are a part of an audience. We're connected. But I hang around people that are connected to COVID, that understand and appreciate the severity of it. And I try to remind my class that I can't let the socioeconomic status of this box be the reason I judge and point fingers at other members of our group. So I often think about how stressful this has been on our mental health,
For
how
sure.
stressful this has been financially for some people, and how there are many of us that we were already had the capability of working from home. And even then, with that bubble, the confluence of personal life with professional life all at the same time is complicated. So what do we need? We need some of these celebrities that access and take money and glean their business from a fan base of city girls to say something, to be present, to say that this is not safe and that this is not healthy and there is a better way to do this. The same way that LeBron got involved aggressively, the NBA held, the players of the NBA held their leadership to account when it came to this part of the George Floyd part of the Black Lives Matter campaign. That's the only way we can do it. The three of us are out working. We're out using our platforms to get knowledge to our folks and to try to get help and to own our seat at the table. But we need people in all of the strata that Black people access to say something. I think about these barbershop conversations.
Yeah.
Some of those are just as problematic, just as ill-informed. And my barber tapped me on the shoulder the other day. He's like, I know you want to say something. I was like, I just want to say this. And he said, go ahead and say it. I said, the vaccine is not killing people. The
Okay.
virus is. And that was it. That's it. You know, they have come up with a contingency of conspiracy theories about the vaccine. And it's like, no, the virus is killing.
Well, there is a lot of misinformation and misunderstanding that surrounds our population, and it surrounds the skepticism, for so many of us. And I think that's another class issue. Before I address that, I wanted to go back to something that you said, that I think we also should pay or be sensitive to. One of the things that I have realized in COVID time is that my home is very comfortable.
Mhm.
And that for so many Black and brown people around the United States, their home is not comfortable.
Mhm.
Mhm.
They can't get online and order a new couch or redecorate their backyard if it doesn't meet up to their standard to deal with the time that we're in, to just to wait out COVID. And I
Mhm.
thought about that. Last year I spent probably about $10,000 redecorating my backyard. And, we we redid our central air unit, anything to make our home more comfortable. And it dawned on me that while I am turning our chateau into, a new palace for us to be safe, to be here and be safe. Our food is stacked. I don't know how many high we I don't know how many feet high. We went out and got another freezer. We can go shopping and get 12 or 15 cases of water and stack that up to have it. So we don't have to go to a grocery store every week. So many people are not in that predicament. And I have to be sensitive to it.
Yes.
The
Mhm.
same way when I talk about we're not getting access to the information, I have to be sensitive to the fact that so many of us are in so many different predicaments. And because home is not safe,
Mhm.
that is why they are out risking their lives, life and limb, to be out in nightclubs, to be out in theaters, to be out in social clubs,
Mhm.
to be out in strip clubs. I realize it. There's so many of us live in situations where we are not safe. And so across every line, there is something in our community that has to be addressed. And like you said, we all have to be responsible for having that conversation and addressing it.
We absolutely, Sylvia, the same households that don't have the internet
Mhm.
for their students to participate in virtual school
Mhm.
are the same households that didn't have the internet to get in this vaccine appointment line
Mhm.
situation. So we have to address it, and we have to address it in a way that extends some level of compassion, but
Mm.
also uses the people that are important to that community, that are respected in that community, for for the access and for the conversation. I think Dr. Hilton's conversation is the right one. I need somebody that connects with people in Atlanta or wherever the City Girls are performing to speak to
Miami.
them,
Yeah. Hmm.
to tell them we are now at the point of double masking.
Mhm. Yeah, double masking and praying, because honestly, and it's one of those things of where, yes, we need to talk to the community, but I want to echo Dr. Holmes and saying, we knew back in August the fact that we had a Wi-Fi insecurity for our Black and
Mhm.
Brown communities. So if you tell me
Before we went back to school, for
before
sure.
we went back to school, so if you tell me when we know that 1 in every 5 children in South Carolina did not have Wi-Fi to be able to
Mhm.
connect to do their learning at their home, if you tell me that you went to that same platform for people to sign up for a COVID vaccine, then you are effectively telling me that you did it intentionally. And
Exactly.
so this is again going back to this whole need for a Department of Equity to have accountability on the federal level to say we're not going to allow you to continue to do these insults to our people over
Mhm.
and over and over again. So that's because I think we have to have two conversations. Yes, one is to the people and to the community,
Mhm.
and trying to engage the community leaders. But as you just stated, Michelle, it's one of these things where the community has been emotionally beaten up for 12 months. Even our strongest community leaders, they're struggling emotionally with everything that they are going through, financial and health wise. So to lean on them even more and not give them resources from the state, from the federal level to
Mhm.
say, hey, we know that you're going out talking talking to whoever will listen on these podcasts. We know that you're going out and you're talking to city girls and trying to explain to them so they can talk to the crowds. Let us put some weight behind you so that you can afford to not go to work that day, so you can do the work of what's going to take to keep this community alive.
Safe.
That's the thing, is we almost victim blame the Black and brown community, say, well, you didn't talk to each other enough. When was I supposed to talk? In between trying to feed my kids and keep my job and avoid COVID? What else do you want from me? But that's what America does. It kicks the can towards us, saying, well, you should have done this, instead of America taking responsibility for the plans that they laid out. And so we have to really push again to, yes, talk to our communities and build that up, but also say, hey, government, we're not going to give you another red penny until you start to do right by us. Because I can't believe what you say, because I see what you do.
There should have been mobile vaccination units outside that concert.
Oh, for sure.
I mean, and it's one of those, not only mobile vaccination, but still, and mobile testing.
Yes, and testing.
People don't, it's like, oh, I think people heard we have vaccines and everyone's like, oh, okay, great. We have now 3 different mutant strains within the United States. From South America, from the UK, from Brazil.
And from South Africa.
Okay. Oh yeah, South Africa. That's what I was trying to say. South Africa, Brazil, and the UK. It's these things. This is not going to change. We are going to get more and more mutant strains, and what that does to the efficacy of this vaccine is to be seen with the newer ones. Now, it's still better than nothing. I want to highlight that. We know that we went from 95% effective to maybe 70-ish%, but of those persons, none of them have died that actually got COVID. And that's the key thing. If we know that the vaccine is not like a umbrella that keeps any vaccine or any virus from being able to enter your system, but what we hope is that if you have that vaccine, that as soon as your body does see that virus, that it's able to start attacking it before the virus has a chance to amplify and replicate itself to overwhelm your body. And the study results are showing that is happening, that people, if you're vaccinated, you don't die. So yes, we need to do a lot of different things at once, but I think it can be done, but it takes intention to do it. So.
Yes.
You both have been vaccinated at this point, right?
Yes.
And are you talking to your communities? I know you are. I'm asking this, just for you to say it out loud. I know you both have been vaccinated, but I know you both are advocating to your communities, for people to get the vaccinations. What's been the response, from people that you're in touch with? Or what's been the pushback?
I think it's been fantastic. I mean, there's been some persons who have said initially, oh, I'm not going to get that. And most time people hear that and they just walk away. But I actually want to engage with that. Let's talk about what causes your fear, because it's valid. Black people, yes, we can talk about Tuskegee from 1932 to 1972, which is only 10 years before I was born. We can talk about Flint, Michigan, that they just now started holding those people accountable, and they still got dirty water in Flint, Michigan. We could talk about how the government unfairly targets Puerto Ricans, right? I mean, they're just now getting funding for a hurricane that happened, 4 years ago, with no electricity. But we never mentioned that same hurricane almost decimated, people in St. Croix and in St. Thomas. We never talk about them at all. So Puerto Ricans are just starting to get the attention. We've never even bothered to mention. Ain't even touched foot over there.
Yeah, right. What's happening?
Right.
There are people that don't even know those Virgin Islands belong to us.
including our ex-president, remember?
Yes.
Okay. But that's the thing is,
oh God. Help us, Father. Help us.
Somebody help us.
He's like, what are our territories again?
Like St. Croix? Like, where's that?
The president, we're like, that's
I will say this, Sylvia. I have definitely been responsive. From the moment at which I got the vaccine at Howard, I loved it because I saw Black doctors, Black nurses. I saw techs, the people literally moving the line, the people in the 15-minute holding looked like us. So again, there's access, there's empathy, there's awareness, there's community that is different than going to a facility where no one looks like you and they're just kind of rushing you through, and they can't take the time to understand how we communicate our uneasiness. and or, you know, our dissatisfaction, whatever that might be. So since then, even that day, I was calling people like, listen, go here. You're in this age group. Come on, they're giving it away.
Right.
But since then, I've had questions, you know, do you have any side effects? Nope, don't have any except a little bit of soreness at the injection site. Got in the shower, that thing passed.
Right.
But I have explained to some why the vaccine came about so quickly. And I don't exactly, you know,
those are legitimate questions.
yes.
Those are
But
legitimate questions.
it's been one where in which, in layman's terms, I've been able to explain coronavirus as a category of a virus we've known about long before this strand showed up within our borders. And using even a Lysol can and the fact that it was already on there made it practical for our community to understand, like, this is a known science, and that the country has a brain trust of people. The previous administration just didn't highlight that, who have always been working to ready ourselves for a pandemic. We were supposed to use the lockdown to contain the spread of it, and then stand up PPE and a number of other things that we just decided after 6 weeks we were out, broke all of those rules. So the community spread, you know, magnified. But again, having some type of practical conversation that they can access, I think has helped alleviate some of the fears caused certainly my primary row of friends to go and try to get themselves vaccinated as quickly as possible. And with that, you know, what did I notice when I went to the barbershop? It was another level of resistance. So that's where I say, you know, we've got to keep accessing and find out who can speak in certain communities to these groups. Otherwise, they're going to continue, to Dr. Hilton's earlier point, to be left behind, because nobody in these meetings is thinking about them. You know, my friends, you know, all have college degrees, all are dual degreed. So we're sitting in this bubble of privilege, all our own, that ties into class and keeps the disparities going. And we have access to go get, you know, a vaccine.
Right.
Meanwhile, they're at the barbershop, you know, coming up with all kinds of theories and conspiracies. I told them, I said, one of them was about the fact that the vaccine has a chip in it. So now the government will be tracking us. I don't know if you've all heard that.
Yeah, well, that actually started you're talking about the 5G. No, the vaccine has a chip, but the COVID spread was because of the 5G
The 5G
towers.
thing. So Dr. Hilton, one of the barbershop theories was that this vaccine has this tracking thing in it. And now they're using the pandemic to make sure that they can track all of us. And so what did I say?
This?
Exactly. I said that cell phone
I mean,
honestly, your electronic fingerprints everywhere.
It's like, you know, and I tell people that's my people. The people in the barbershop, that's my people. That's my family. And the thing is, and we've had these conversations.
Some of them are mom too.
Right. The one way that I broke through to them was I said, okay, I didn't grow up in a medical family. So I completely understand where the mistrust comes. So my thought was, so let me just take a sit back and just look. Let's people watch. Because the very people that were saying you don't need a mask, the very people that were saying COVID-19 is a hoax, when they got infected, the ex-president got on a helicopter, was flown to another hospital to get $1 million worth of medication that wasn't even approved for other humans.
Yes.
And as soon as the vaccine was made readily available, after he's having these widespread, you know, super spreader events, President Trump, President Pence and his wife, Lindsey Graham, Senator McConnell, Marco Rubio.
The entire administration. Yep.
The entire administration, if they had power and wealth and access, were the first ones on stage to get vaccinated. So you can sit back and think, oh, this thing is going to kill you. You think they would be jumping over your grandmother who's 80 years old to get vaccinated first if it couldn't save their life? When it's your turn to get vaccinated, you better show up. That's the kind of conversation that we have to have, explaining in real life just situations like that. But then if we want to go through the details and talk about why it's so fast, we can literally even say mRNA vaccines have literally been used as cancer treatments. Back in 2003, we had mRNA vaccines for melanoma. The way that this works is literally it can detect, we train your body to detect different proteins that are produced, if that cancer cells produces that protein, then instead of giving your entire body chemotherapy, we can train your body to say, hey, recognize that breast lump right there? Yeah, get rid of that. Right. So this is, and the process is speed by which it happened. It's got typically vaccines, you have to prove first that the vaccine will work, and then you can start making the vaccines in large numbers. Since so many people were dying at once, the government said, hey, and not only our government, but all governments across this this globe said that we will give you money to start making these vaccines as you're proving that it'll work. So on the very first day that you come out and say, this is what our studies show, it show that it's safe, it show that we are ready to go, then we have vaccines on day one and not 5 months later in the process of where another 500,000 people can die. So that's the difference in the cell thing. But we know Trump, he made it political because he needed it in order to get reelected. So he had to say, this is warp speed and it's so fast and we're doing this that no one else has ever done before, without speaking truth to people. And it's unfortunate because it caused distrust.
And listen, I believe without the pandemic, I believe he would have been reelected. You know,
Sure.
yeah, I believe he would have been reelected. I want to talk a little bit about, some of the, you both keep mentioning the barbershop and the hair salon. And why I think it's so important is because when I think about where people go to get their information, right, in our communities and who they trust, it's who they trust inherently, I talked some years ago to a duo who owned a barbershop in the Midwest, and they opened up a health clinic inside of their barbershop. And that though some of those men that were being seen in that health clinic had not been seen by a doctor prior to that opening of the health clinic inside of the barbershop in 25 years. So when I think about who we need to empower as we talk about this new administration and all of the different ways in which we probably need to make sure where we're depositing people. You talked about mobile health units; those are great. These the new clinics that are popping up around the country, those are great. But when I think about how we access care, it would make sense to me that we are putting mobile clinics inside of places that we trust, in our faith centers, okay, inside of our barbershops and our hair salons, you know. And now that we know that the vaccine is on its way to retail pharmacies,
Thank
retail
God.
pharmacies, thank God. But
Thank
some of
God.
these retail pharmacies that the vaccine is heading to, they're not even available in the South, you
Actually,
know?
and if you look at it, just like we have food deserts within Black and brown communities, 70% of all pharmacies and drugstores are in predominantly white communities.
White neighborhoods. Yeah.
If you are in a predominantly Black or brown community, you are more likely, twice as likely, to see your hospital be closed than if you're in a white community. So yes, I'm all about, in this acute phase, putting these mobile clinics into the barbershops. We need to make them permanent though. And that's where, again, holding the government, again, if they are taking our tax dollars, we need to hold them accountable for providing us with the same resources they give predominantly white communities. One school that I used to mentor down in Charleston, South Carolina, Meany Street Academy in Brentwood, the first day I went to go and survey the school, I walked in, I was like, wait, what's this? And it was a elementary school with a full-fledged clinic inside of the elementary school. And I said,
Brilliant.
now unpack this for me. Tell me what you're doing.
Brilliant.
They had 5 examination rooms with telehealth, where you can have an otoscope, so that the nurse could put the otoscope in the ear, and a pediatrician could actually view it at the hospital down the street. That a stethoscope that allowed for the same capabilities. And what they said was that we had a lot of children who, unfortunately, it was a Title I school, whose parents weren't able to either come and get them to take them if they were sick, or if they did come and get them, they had to miss work. And the prescriptions weren't being filled. So we put a clinic actually in our elementary school. So now parents wouldn't have to do that. And we can keep that child in school, get them the antibiotics and things that they would need. The parent wouldn't have to miss work. The child is healthier, can go back to school, to class. And it's this continuum of care that allowed for us to address the need of the actual student, instead of making the student and the parent have to address it on their own. And that was tremendous. And that can happen across our nation of
Yeah.
combining our forces to say, especially in these communities where we don't have a hospital system setting. If we did have in our elementary school where we know parents have to go and take their children and pick them up every day,
Yeah.
that could be a source for not only the child to be seen, but also the parents too. So
Well, when you think about how many children are the children of first responders in poor communities, or in
mhm,
underserved and under-resourced communities.
mhm,
These parents don't have the ability to be able to take off for work to do a
mhm,
lot of the things that we're talking about. One
mhm.
of the things I saw an interview with Stephanie Rule on MSNBC with Michael Bloomberg, and he kind of burns my billy goat a little bit. He really does, because he speaks from such a space of privilege, and he's talking to teachers about, they're just going to have to suck it up and get back to work.
Mhm.
We are going to have to be innovative in these efforts to make sure that across the board, teachers unions are able to do, and schools are able to do what they need to do to make sure that all of their teachers are vaccinated. All of their teachers have access
So
to
I
the
I
vaccination.
saw part of that interview today, and when we got
It enraged me. It
yeah, when
enraged
he
me.
got to the teacher thing, I had to check out because it does not follow, in my mind at least, that you would say we need to reopen schools, and they've been saying it and yelling it since last summer because
Right. Right.
apparently no one wants to be home with their children. I
Right.
get it. I
Right.
understand that.
Right.
But you don't, in the prioritization, you don't place a priority on the teachers, the
Right.
crossing guards, the
Right.
cafeteria workers,
For
the
sure.
infrastructure that it takes to manage the school.
Right.
Mhm.
So there is no surprise that there is an outpour just this week in Chicago. There's one here in DC from the teachers whose lives are at risk, who are parents as well, who have compromised immune systems and all sorts of other challenges. You want them to manage your kids for 8 hours so that the economy can suddenly, go back operational. But why wouldn't someone, i.e., on Dr. Hilton's equity uh, secretariat, say, well, we need to set aside 200,000 doses of this vaccine then, if
Yeah.
we're going to open these schools?
And I think I do believe that this administration has better ideas, right?
Yeah, yes.
They have a lot better ideas. They've got a lot better um people coming to the table and involved in these
And they
cabinets.
and they're following the science.
They are following the science. They are definitely following the science. Some of the issue though is we haven't seated the entire cabinet and the entire administration yet.
No.
We are still going back and forth on when these people will be confirmed. And so they're not able to address all of the issues that need to be addressed. But this rush to just send children back to school, just because we're talking about the achievement gaps, and we should be talking about the achievement gaps. One of the issues that I will never be able to understand is why we are still in a country like the United States are still paying for Wi-Fi. It is one of the things that we could do to make sure that every home, um, every neighborhood, every community. When you think about people who, when they leave school, right? What One of the things that we found out very early on in the process was that when we sent people home and they did not return back to school buildings, they lost contact.
Criminal.
They lost contact
Mhm.
with a large part of the population of the school. And it was because they didn't realize what those kids were going home to. Some of those kids live in shelters.
Yeah.
Some of those kids live in shelters. So some of those kids are exposed to COVID in the shelter environment. Some of those kids don't have access to Wi-Fi. The
Wi-Fi.
meals that they eat are only the school lunch, are only the school breakfast. They don't eat again until they return back to the school. These are
Mhm.
all of the things that we apparently didn't realize until everything shut down.
And,
And we had an administration that didn't deal with any of those things for 9 months. And so now, where it's not only it's a rush to return, but we have to pay attention to what we've learned in this time frame. What have we learned in this last year? And to me, there's so much information and so many things that should be gleaned from this time period. We should have learned a lot more in this last year than we are talking about.
well,
Mhm.
I mean, I think honestly, I don't think we've learned anything necessarily new. What we know is that 1 in every 3 Black families have a zero or negative wealth. That has not changed. That's not something that's different. And
If anything, COVID has exacerbated it.
it's exacerbated. I mean, at this point, we might be looking more towards going towards 50%. What we know is that 60% of all Americans make less than $40,000 a year. What we also know is that in order for America to exist with this capitalism, and it's really, we're a young country, we have to take a step back to see, is this thing working? Because we created, capitalism depends on a have and have nots.
Mhm.
You need a buyer and a buyee, right? You need somebody that's going to be the employer and the employee. And so it creates this structure of keeping people in these sections of class. And when you do that, if you take one individual, you take a nation, and you make them sick, hungry, and uneducated, you're dooming it to fail. And we are stripping finances, our budget for education, for food. We see in our, for our food bank lines going crazy, and health. We strip those 3: food, education, and health every single year, and really every single administration.
And
So
put it into our defense budget. Yeah.
right. And so, we have $740 billion to go to the Department of Defense. We have money. It's an intentional thing to not address the fact that we knew our Black and brown children were not eating when they went home. We know who gets free food at home, at school. We know it.
Mhm.
We
Yeah.
know.
The data points were there. The data points were there. Right.
Right.
We are running low. We are running low on time, and this conversation, so necessary, and it's something that we have to continue. I'm going to charge both of you that as the information continues, that you've got to come back, because there's just so
Yeah,
much.
'cause we got to keep working on fixing it.
We've got to keep working on fixing it. And listen, we've got to continue to highlight and use our platforms for conversations like this, because it's necessary. And
Definitely.
anything that we can do to shine a light, and make sure that we are doing our due diligence for our communities. It's about impact and it's about reach. And so I am charging both of you, and I know you'll continue to do great work, but I am also asking that you'll come back and lend your voice to this conversation, because it's so pivotal. And I thoroughly appreciate you being here today.
Yeah. Thank you for having us.
Yes and yes.
Yes and yes. All right. So we shall talk to you soon. Enjoy the rest of your evening.
You do the same.
Yeah.
Thank you.
All
Take
right.
care, Dr. Hilton. Take care.
Bye.
Sylvia.
Good to see you.
Good night, guys. That's it for us today. Next Nation. Stay tuned. What's your story? Next Nation, the podcast, would like to thank Sphere Podcast Studios in Houston, Texas, under the direction of Gary Lee. Our creative launch team, Latif Harris, Devon Warren, Emo Rice, Tiffany Thompson, Tanisha Malone, Hugh Cardis. Music production by Jean-Pierre Zephyr. My writing coach, Linda Jones of The Writing Doula. Spiritual leader, Reverend Timothy Atkins Jones. And finally, my family. My husband and associate producer, James J. Alston. Thank you, honey, for all of your love and support of this effort. My mom, Shirley Key. Mommy, I love you forever and always. And finally, my children, Noah and Ava Alston, who also act as junior producers for Next Nation, the podcast. Thank you so much for listening. We'll see you soon.